Hey, Dr. Christianson here with you. So, how can you shrink thyroid nodules? How can you get them smaller naturally? That's what I want to talk about in this video, and I'm really excited to share this information with you. So, for starters, I want to acknowledge the fact that it can be pretty freaky to have thyroid nodules. It can be left pretty unsettling to be aware of them. And it's important to understand the context of why that's true. You know, when someone's aware of thyroid nodules, it's usually at the end of a chain of several other events. The first one of those events was that, they were probably functioning along as an adult, doing well enough and feeling okay, and then they weren't. They had some symptoms come on. Suddenly their weight went up. They were tired. Their hair was thinning. Their cycles changed. Something really blindsided them with their health. And they probably had many years where this lacked an explanation. And there was likely several encounters with doctors in which they were told everything was fine. There was nothing wrong. It was all in their head. And then eventually they said, oh yeah, I guess your thyroid is off. Your thyroid was causing that. And then they said, oh, hey, by the way, you've got these nodules. And well, they're usually not cancerous, but sometimes they are, and try not to worry. And you think this through, this person's been jaded. They've been really disillusioned about the medical world. And also they've come to have less trust in their body working for their best interests. They know that things go wrong. They know that the doctors don't always tell them what's going wrong quickly enough or with good answers, and they're left uncertain. So yeah, of course they'd be frightened and upset and worried. That makes perfect sense. Anyone would feel that way in those circumstances. So let's talk through about what these are, how they're relevant, and what can one do about them. So for starters, I think it really helps to get a sense about, how common they are. And the numbers are really shocking. One simple approximation is that as adults, each year of our age is about our percent risk for developing thyroid nodules. So that means just what it sounds like it means. If you're 50 years old, you got like a 50-50 chance of having some nodules. If you're 80 years old, you've got an 80% chance. Now, of course, it's not a perfect number, but it's pretty darn close. So yeah, they're more common than not. Women are more apt to get them than men. Some are around 3 times as many. And then age is the other biggest driver. And then thyroid disease. So if someone has thyroid disease, that by itself raises their risk of thyroid nodules. We know certain things can also change the likelihood of them. One that's talked about a lot is radiation exposure. That's really not that much of a big factor today. Back when radiation was used for swollen tonsils, or to measure your shoe size, there are all kinds of goofy things that it's not used for anymore. And back then, that was a big driver. So it's still in the books, but it's not commonly a factor anymore. A couple of things that can be factors, smoking status, tobacco use in general, alcohol use, those both raise the risks, and then waist circumference. So the larger one's waist circumference is, the more risk there is of developing thyroid nodules. We'll come back to that again. Now, nodules are important because they're precursors to thyroid cancer. They can create a risk for thyroid cancer. And what they are is they're basically lumps. So think about your thyroid as a big sponge, and imagine like all the little holes, little pores inside of a sponge. So the thyroid is a collection of little holes. It's all little clusters of cells called follicles. And these cells grow rather quickly and they die rather quickly, but they don't always grow perfectly. And if they don't make the right kind of openings inside those follicles, they get lumpy. And that's what a nodule is. It's part of the thyroid that's denser than what is around it, or that's got a large opening, a large fluid-filled vesicle. So that's what they are. They're just imperfections in the density of the thyroid. And we use them to distinguish between other types of structural disease that's more uniform. So if the whole gland is enlarging, we call that a goiter. When part of the gland is lumpy, we call that a nodule. And that's the relevance of that. Do these cause symptoms? Well, they can, but they rarely do. So because they're so common, most cases they're in this range of several millimeters, basically as small as can be detected, up to roughly a centimeter or slightly greater. And at that size range, one is usually not aware of them. But that can be different. So sometimes they're bigger, Sometimes they're pressing on some delicate nerves. Other times they're up against structures that affect speaking, swallowing, moving one's neck. So yeah, and if they're really big, they can be visible. There have been a couple of rather famous stories of people in the public eye to where they were on camera, they were doing a movie or a news story or something, and fans identified they had lumps in their thyroid and encouraged them to check that out. So that's the most extreme example. But yeah, in most cases, there's not really symptoms of them. So how would you know if you have nodules? Well, if you've got the massive ones, again, they could be visible. As we go down their size, then they can be picked up by self-examination. This is a good idea. Each month, take a bit and feel up your thyroid. Just check it out, see if there's been changes to its size, shape, or structure. We know about the idea of breast self-exams. It's no different, and it's just as important. So you may identify nodules by feeling your thyroid. Next down we go to doctor's exams. So just a doctor doing the same thing. And they can identify nodules when they get bigger and they become more obvious. The most surefire way to identify them is with medical imaging techniques. And that can be done when the thyroid is screened specifically, or it can be done when something else is done and they happen to show up. So in the latter scenario, someone might have a CT or an MRI, and maybe it's for their cervical spine, or it's checking part of their head. Whatever, the neck might show up in that. And if it does, they might see thyroid nodules if they are there. So sometimes they show up as just incidental findings on other medical imaging tests. But the most common scenario is when a dedicated ultrasound is done for the thyroid. This is also called a sonogram, and this uses sound to really look at differences in tissue texture and tissue density. And that's what the nodules are. So ultrasounds show them up the most. And it's very common that someone has had doctor's exams that never identified nodules, but they did show up on ultrasound. So that's the most surefire way to see them. So we talked about some of the things that are associated with them, who's more apt to have them, generally not going to cause symptoms, how you know if you have them. So the next question is, how are they treated? How are they treated in the medical world? Well, in most cases, they're not. In most cases, the guidelines are just to ignore them or maybe adjust a schedule of ultrasounds because of them. So if they're large enough to be a concern, but not big enough to biopsy or think about treating directly, a doctor may recommend a regular schedule of imaging. And it might be annually, might be 3 to 6 months. But the idea there is to see if they are changing quickly and if they are becoming more worrisome. If they do look worrisome, they may be biopsied. And this can come up if they're quite large, if they appear to have heightened blood vessels, if they're calcified, if they're growing. These are all some of the considerations that are taken into account. And so with the biopsy, a sample of them is taken and then analyzed under a microscope. And the idea is that if the nodule contains some cells of thyroid cancer, they would generally be visible, and one can then be aware of that. Nodules may also be removed. So if they're quite suspicious and they're growing, or if they're cosmetically a concern or causing symptoms, they may need to be surgically taken out. And there's also an in-between to where if surgery may not be needed, now there's an option of radiofrequency ablation. And that's a pretty cool thing. It's basically a small needle that's inserted inside of a nodule, and it's then heated up. And so you can shrink a nodule on site, but not have to have a scar or a procedure and not really have harm to adjacent thyroid tissue. So if a nodule is big enough to where it's really got to change, but surgery may not be a good fit, this is another option people have available. So let's say you've got nodules. Let's say that, medical treatment is really not a consideration. Biopsies aren't needed or they were negative, but they're there and you're concerned about them and you want to be proactive. You want some way to help them come down. So that's the real meat and potatoes of the discussion here is how do you shrink them naturally? And the cool thing is you've actually got some really good options. There's good data on this. And I'll talk about a couple of categories. Basically, there's supplements, there are some dietary changes involving iodine, there's considerations about one's TSH, and there's considerations about one's waist. We'll talk about all those. Now, there's a special role to play in the evidence towards supplements, and that's because it's been shown to reverse nodules. The other factors I'll address have been shown to cause nodules to grow faster, and with some, there's some evidence that it may also help them reverse, but we have the most direct evidence of reversing in the case of supplements. We've got several clinical trials showing that safe combinations can make nodules get smaller. And I'll first talk about those, then I'll talk about the other categories of steps one can take. Also, I'll mention them first because they're easy, they're simple to do, and these are safe options. So a couple of different clinical trials were done, and the first two I'll mention were combination trials, meaning that multiple ingredients were checked at once. And these were good studies because they had a control group that had a placebo arm. So what that means is there was other people that had thyroid nodules that took pills that looked just like the active pills but weren't. And they tracked to see if any changes occurred in the control group. And sometimes changes will occur in a control group just because changes can occur randomly. But if there's a placebo arm, we can also see if changes occur due to just expectation. And that's important. There are some things that expectation or random change can be quite significant. So it's not enough to say that someone took a supplement and they got better. We want to know that it wouldn't have happened by random chance. So all these things I'll talk about are items that had high quality human studies with randomization, control arms, and placebo groups as well. So we know that these benefits were not just random chance. And these are also ingredients that have a very high margin of safety. These are things that are naturally occurring in food, many cases have been used as food, and do not interfere with other thyroid treatments. So they're not things that are going to contain hidden versions of iodine. They're not things that would disrupt thyroid medication. And they're not things that are generally known to cause harm in other ways. So very good safety margins. The first trial I'll mention was a combination of 3 items, and that included spirulina, boswellia, and curcumin. Now, spirulina is a blue-green algae. It's not a seaweed or sea vegetable. It's a type of algae, and as such, it's low in iodine. It's a high source of a lot of common micronutrients. Also, it contains antioxidants. It's unique in that it has superoxide dismutase. That's one of the main antioxidants the thyroid gland makes to protect itself, so it's quite useful. Curcumin, many familiar with. This is one of the compounds from turmeric that gives it anti-inflammatory properties. And boswellia, this is another name for frankincense. So this is a tree resin that's been used as an aromatic and as a medicinal compound for thousands of years. So in a clinical trial, this was a double-blinded clinical trial, people were given a combination of the 3 of these, and they were tracked to see how this affected their thyroid nodules. Over the course of a 6-week period of time, now that's not very long, that's a month and a half. When we think about changing a structural part of the body, yeah, not very long at all. But over the course of 6 weeks, over 85% showed a significant decrease to the volume of their nodules. Their nodules shrunk, and most of them got better. And they shrunk by a lot. The average size reduction was 0.6 to 0.9 cubic centimeters. That's about the size of a marble. So this was an outcome that took place without other interventions. These people weren't on thyroid medications, they didn't have procedures done, they just took some safe combinations of supplements. Now, another clinical trial used a combination of inositol and selenium. Selenium, we've talked about it, that's an essential micronutrient, and it's a great buffer for iodine. If we lack selenium, our body's ability to deal with changing levels of iodine becomes that much more difficult. We can't manage even the slightest excess. If we have adequate selenium, we've got more leeway and we can do better at a broader range of iodine status. It's also needed for really all the iodine regulating enzymes that are used to control thyroid hormones and many of the antioxidants that keep the thyroid working well. Inositol, it's a fascinating thing. This is a conditionally essential carbohydrate. And it's been shown to have roles to play in regulating the immune response, controlling rates of cell growth and repair, and also buffering blood sugar, all of which can be relevant to the growth of thyroid nodules. In a clinical trial, 642 people were evaluated for thyroid nodules. Of those, they found many that have them, and the average age was 41, most were female. And of them, 333 were randomly ascribed to receive combination therapy of selenium and inositol or no treatment at all. What they saw was that those who were treated saw average nodule size reduction by about 26%. So they went from about 16 millimeters down to about 12 millimeters. They also saw that none from that group went on to develop thyroid cancer. That's pretty cool. That was not true for the control group. There were several cases of cancer that emerged in the control group. But there's more. This group also saw TSH scores averaging from 4.2 decrease down to 2.1. So their TSH scores dropped by about half. They improved. And yeah, none went on to develop thyroid cancer. So nodules got smaller, cancer risks were reduced, and overall thyroid function improved in this group. Now, the last compound that I'll talk about is called Prunella. This has been used forever in Chinese medicine. It's got a lot of names. Heal all or self-heal have been common ones for that. It's basically used like a food. It's a very safe nutritive herb that's got a lot of good general anti-inflammatory properties. There have been a large number of human studies done on its effects specifically for thyroid function. Prunella has been looked at in over 11 pretty high-quality trials with over 1,200 participants. And a summation showed that it's improved thyroid antibodies, it's shrunken the gland when it's swollen, it's reduced the size of nodules, and also improved clinical symptoms for thyroid disease. So I've made a blend called Nodule Support, which combines all of these ingredients. From the first trial, we've got the spirulina, the boswellia, and the curcumin. From the second trial, we've got the selenium and the inositol. And then finally, we've included the Prunella due to its large amount of high-quality human evidence. And this is just an easy way to get all of those things in the right amounts, in the right forms at once. So dosage with this that I encourage is 2 capsules once daily. That gives the full therapeutic amount. And time frame, think about a 12-month time frame. It often takes 6 months to see a clear change in nodules. And whatever you do, you want it to really have time to become stable and to let the reductions become consistent. So minimal time frame of 12 months is recommended. Okay, so that's for supplements. So the other considerations that we have include iodine, TSH levels, and waist circumference. And these have also been shown to have relevant effects upon thyroid nodules. So iodine, this is a fascinating one. There's a lot of data on how in pockets of the world historically that were low in iodine, there were higher rates of thyroid nodules. Well, now we've got data showing that when we're slightly above this iodine window, we'll see higher rates of thyroid nodules. And that's more of a common concern in the modern world. As a generalization, iodine deficiencies occurred in areas that had subsistence diets. They often just had like 1 or 2 crops that made up the bulk of their caloric intake. Like rice or corn or cassava. And they also didn't really have soil that contained much iodine. They didn't have iodine fortified in salt, and they didn't have a variety of foods. They just had like a couple locally grown foods on deficient soil. And in those areas, levels were low enough to cause more thyroid disease, especially amongst children. So in areas in which we have a more abundant food supply, that's thankfully not the case. But we run the risk for too much iodine being a culprit. We think that about 50 to 200 micrograms is the sweet spot. That's where we see the lowest rate of thyroid disease among adults. One clinical trial looked at 3 groups of people. It looked at those that had normal thyroid structure, those who had nodules, and those who had papillary thyroid cancer. And what they saw was that the iodine status was distinct in all those groups. Those with normal thyroid function had healthy iodine levels. They were about 174 micrograms per gram on average. And that's in that range of that intake that I outlined. Those with nodules were averaging about 330. And those with cancers were the highest at averaging over 400 micrograms per day. So the more our iodine intake goes up, the more we have severe structural thyroid disease emerge. So a very important action step is just being aware of some of these big sources. We can find it in supplements, in cosmetics, dairy products, processed grains, pink Himalayan salts, and things you wouldn't expect. If you've not already, please take a look at the Thyroid Reset Diet. I walk you through how you can get to a safe level for iodine. And that can help cut the risk of nodules growing. It can help raise the chances of them shrinking, and it can also improve overall thyroid output. And that becomes relevant as we come back to the TSH levels. Okay, next up is waist size. So when the body is growing in one way, it can grow in other ways. And unhealthy cells, like nodules or cancers, are more apt to grow when the body has a high growth signal. So we've looked at ways to predict this, and it can correlate with insulin levels, but also there's this thing called metabolic syndrome, and that encompasses higher blood pressure, higher triglycerides, higher cholesterol, higher blood sugar. So all these things can cluster along with this heightened state of exaggerated growth that can fuel nodules. The one variable that's been most sensitive to nodule growth has quite simply been waist circumference. So papers have shown that it alone can predict the likelihood of one to develop nodules and then how likely it is for them to keep on growing and causing a greater risk for cancers. So your waist circumference, specifically it's the belly button, like how many inches it is around your waist at the level of your belly button. Magic number, it should be less than half of your height. So if a woman was 5'2", she would be 62 inches. And so half of that, so 31. So she'd want to stay clear of 31 inches around her belly button. The closer she got to that, the more of a problem that can be. So if your waist is up, the most effective way I've found to reverse that is through protein-sparing modified fasting. That's the basic idea behind the metabolism reset diet. And most can see pretty big changes in their waist in a short period of time. We'll see averages of about 2 to 4 inches of waist loss within one 28-day reset. And that can be enough to make a big difference on one's overall metabolic health. And okay, last thing that can shrink thyroid nodules naturally is controlling one's TSH and keeping it on the lower side. So TSH is thyroid stimulating hormone, and it causes the thyroid to be fruitful and multiply, to grow additional cells, to get bigger. And to a point, that's wonderful. Past a point, that means it's going to grow out of control. And it can even cause growth in abnormal structures within the thyroid, such as nodules. So yeah, the higher the TSH is, the more likely nodules are to grow and progress. And to some extent, the opposite is also true. When the TSH is lower, nodules are more likely to shrink. And that's because without a TSH signal, the normal rate of cell death is not kept up by cell growth. And so normal rate of cell death means that things get smaller. And the range at which that happens is probably somewhere just below 1 international unit per mil for TSH, so somewhere below 1. Now the consideration here is that if the TSH is too low, there can be hyperthyroid complications. Most people do not have to worry about that if they're slightly below 1, but there are some that can see side effects from that. So how do you lower your TSH? Well, you can do so naturally with the guidelines of the Thyroid Reset Diet. Also, the nodule support that I mentioned did lower TSH scores amongst many participants. If you are on thyroid medications and you're taking far too little, you can work with your doctor to adjust your TSH scores to a healthy range like that. And as you're getting better thyroid function, you may well need less medication. So it's really a balancing act to take enough medication to keep scores good, but not too much, because too much becomes counterproductive and it also makes the scores go too low. So yeah, the main way to think about the TSH though is controlling one's dietary iodine through the thyroid reset. That by itself can improve that number dramatically. So if you've got nodules, what do you do about them? Well, get in the habit of the monthly self-exams, checking your thyroid on a monthly basis. Stay current with your ultrasound studies. If you've not had one for who knows when or ever, get one done, and then talk to your doctor about how often would be best to repeat them for you. If you have some that don't warrant medical treatment, but you're concerned about them, nodule support can be a safe way to help. This is a supplement blend made exclusively of ingredients that have all been shown through human studies to make nodules smaller. And quite simply, 2 capsules once daily. Think about a 12-month or greater time frame. Also be aware of your iodine intake. You want to stay somewhere below 200 micrograms for general health and below 100 micrograms to improve thyroid output. Think about waist circumference. Make sure your waist is well under half of your height. And then be aware of TSH scores. If they get too high, they can excessively stimulate nodules. So you've got a lot of things you can do, some of which are pretty easy, and you can make a big difference. So there's always things you can do to make a difference and to improve your health. And this is where you can do that for thyroid nodules. All right, Dr. C with you. Take care, and I'll talk to you really soon. Bye-bye.